Welcome. Have you ever heard of physical therapy for your pelvic floor? Whether you're experiencing pelvic pain or discomfort, have had a pregnancy, are currently pregnant, or are just curious about improving your overall health, pelvic floor therapy might be for you.
I'm Dr. Taylor Easley. I'm a pelvic floor therapist here at GoPT.
In this video, we'll learn about the anatomy, physiology, and common conditions relating to the pelvic floor. We'll also be talking about how and why physical therapy can help, including hands-on techniques, exercises, devices, and most importantly, education. Let's start off by learning what exactly is the pelvic floor and what does it do.
When talking about the pelvic floor, we're referring to a group of muscles that support your abdominal contents at the base of your pelvis. Pelvic floor functions can be summed up by the 5 S's, which are sump pump, sexual, support, stability, and sphincteric.
Sump pump refers to the part the pelvic floor plays in normal blood flow and lymphatic drainage, helping to return fluid back to the heart. The pelvic floor is also the area of our sexual organs, so the pelvic floor muscles can be involved if you have pain with sex. Support refers to how the pelvic floor supports your internal organs, as well as your uterus during pregnancy and as your baby grows. Stability is about how the pelvic floor stabilizes and assists with force transfer from the impact of your foot on the ground up through your leg, hip, and spine. The pelvic floor also plays a part in controlling intra-abdominal pressure when performing a difficult lifting task or movement. Sphincteric is about sphincter control of both the anal sphincter and the urethral sphincter, impacting both bowel and bladder function. So you can decide and remain in control of when you go and when you hold both stool, gas, and urine. Pelvic floor dysfunction can be present in both female and male anatomy, though is more frequently discussed in regards to females since pregnancy causes many changes in the body that can lead to pelvic floor dysfunction.
Some common conditions that involve the pelvic floor include stress incontinence, urge frequency and incontinence, pubic symphysis pain, pain with sexual intercourse, pudendal neuralgia, a hernia, diastasis recti, pelvic organ prolapse, constipation, and tailbone pain.
Stress incontinence is the leaking of urine, stool, or gas with sneezing, coughing, laughing, squatting, essentially anything putting pressure down through your pelvic floor. Urge incontinence is when you have a very strong urge to pee and leak urine on your way to the toilet. This can be an issue with or without leakage if you have a very strong urge when your bladder is not full or after you eat certain foods or drink certain things. Your bladder can become irritated and cause you to have the urge to void with low urine volume for many reasons. Common bladder irritants are actually most often the result of dehydration, leading to high urine concentration. Caffeine, artificial sweeteners, carbonated beverages, alcohol, and food with high acidity, such as tomatoes, are common culprits. You can also create a pattern of early voiding by constantly peeing just in case when your bladder isn't quite full, which can reduce your bladder's tolerance at times when you may have to let your bladder fill, like when traveling. Pubic symphysis pain is most common during and after pregnancy due to ligamentous laxity caused by increased levels of the hormone relaxin. It is characterized by pain at the pubic symphysis, groin, front of the hip, or lower abdomen, especially when walking, rolling over, or pushing something with one foot. This is treated by strengthening the pelvic floor along with the hips to provide improved stability to the pelvis and reducing shearing forces through the pubic symphysis. Pain with sex for people with female anatomy is unfortunately quite common, but is generally not discussed enough for many people to know that this is not normal. This pain can have different causes and can absolutely be treated with pelvic floor therapy. If you have any pain with sex, we can help. Pudendal neuralgia is a condition where the pudendal nerve is impinged somewhere along its path to the genitals. This can occur in both male and female anatomy and is characterized by tingling, burning, shooting, or stabbing pain into the genitals, perineum, and/or anus. Diastasis recti occurs most often with pregnancy, though can happen to anyone who frequently has increased abdominal pressure that is not well managed or controlled. This is the ability to control the separation of your rectus abdominis muscle, your six-pack portion of your abs. Deeper abdominal muscle layers can be trained to reduce a diastasis recti. Pelvic organ prolapse is also most common during pregnancy and is when either the uterus, rectum, or bladder ends up sitting a little lower after a vaginal delivery or pushing during delivery, even if it resulted in a C-section. This is felt as a pelvic heaviness, or sometimes can even be seen as something sitting at the vaginal entrance or past the entrance. This is typically treated with pelvic floor strengthening, though can require surgery followed by therapy if very severe. Constipation is a common condition that tends to go unaddressed and undiscussed until it has already caused more severe issues such as hemorrhoids. Bowel movements should be pain-free and relatively easy to pass, requiring only slight pushing and no significant straining. Pelvic PT can help you address the possible causes of your constipation, including dehydration, diet in some cases, and most importantly, improper voiding patterns and habits, as well as positioning. Pelvic floor physical therapy can help address all of these conditions with education and a discussion of habits and behaviors first and foremost. We find that it is incredibly helpful for our patients to understand how their behaviors and habits may be contributing to their pain and dysfunction, so we are passionate about education and ensuring understanding. Along with education, manual techniques may be used if needed for muscle relaxation or strengthening. Exercises for home will be provided to address your specific presentation needs and goals. Modalities such as use of a biofeedback unit also help to provide awareness of the pelvic floor. The combination of these treatment options will be curated to best serve you and your goals. We hope you learned a little more about your pelvic floor and how therapy could benefit you. You can learn more about pelvic floor physical therapy on our website listed in the description. Thanks for watching.